Hi there, mom and dad. Are you wondering if your child or your baby is getting enough sleep? Or you're worried that your baby is sleepwalking? Or has some nighttime terrors? Or you just have a lot of questions about sleep in kids in general? Let's talk about it in this video. But before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. In today's Ask Me Anything episode, I answer your 10 top questions on sleep in kids. So, so let's get right to it. First question: how much sleep does my child need? So sleep requirements depends on your child's age. Let's go through the sleep requirements. So according to the American Academy of Pediatrics, the recommended sleep durations are the following. For infants 4 to 12 months of age, these babies need 12 to 16 hours of sleep in a day, and this includes naps. For toddlers, your terrible twos who are 1 to 2 years old needs 11 to 14 hours in a 24-hour period, and also including naps. For preschoolers, for kids who are 3 to 5 years, they need 10 to 13 hours of sleep a day, also including naps. How about school-age kids? Those who are 6 to 12 years old need 9 to 12 hours of sleep in a day. And teens, they also need a lot of sleep. Teenagers 13 to 18 years need 8 to 10 hours of sleep for 24 hours. Next question, number 2, how can I establish a bedtime routine? Well, mom and dad, you need to be consistent about your child's bedtime routine. And of course, first, before anything else, establish a bedtime routine and then be consistent with it. An example of a bedtime routine is that after dinner, have your child take a shower, and after shower, read a book, and then listen to soft music. And then it will signal your child that it's time to wind down and go to sleep. But again, be consistent with the sleep schedule, with this bedtime routine. Next, you have to establish a regular bedtime and wake up time. Do this on weekdays and even on weekends. And lastly, create a sleep environment which is conducive for sleep. Make sure that the room is dark, it is cool, and it is quiet. Okay, third question. What are the signs that my child might have a sleep problem? Things that you should watch out for that would make you worry and to let your pediatrician know that it might be something else. My child might have a sleep problem. If your child has difficulty falling asleep, or your child has fallen asleep but has difficulty staying asleep. Also, if there are signs that your child might have sleep disordered breathing such as sleep apnea, if your child is snoring or gasping at night, or there are pauses of breathing during sleep. And the last category, you should worry if your child has sleepiness during the day, and during the day, like the teacher has noticed that your child is irritable, or your child has behavioral problems, that your child is hurting other kids, or your child is hyperactive. All right, fourth question. How much screen time is okay before bedtime? Well, the American Academy of Pediatrics, or AAP, recommends to avoid screen time, and this includes TV, smartphones, tablets, at least 1 hour before bedtime, as they can interfere with sleep. And I would like to remind you the recommendations from the American Academy of Pediatrics that kids who are 18 months and below is not recommended to get screen time. And for 2 to 5 years old, non-educational screen time, you should limit it to less than 1 hour a day. All right. Fifth question. Should my child nap during the day? Well, napping can be helpful for kids. And in fact, these are recommended and you can count them as a part of their sleep duration. Just make sure to avoid naps late during the day and avoid long naps that is too close to bedtime so that it would not interfere with your child's sleep. All right. Number 6. What should I do if my child is afraid of the dark? It is a common problem that parents have. What I would suggest is to gradually expose your child to the dark. You can do this by using nightlight or allow a small light to pass in the room. And also, always reassure your child that you're there, you're just in the other room, and offer comfort as well. Number 7. Is it normal for my child to sleepwalk or have night terrors? You can check the link on my other video on sleepwalking or night terrors or nightmares. These are relatively common in kids, and usually kids would outgrow them eventually. What I want you to make sure is that you remove obstacles from their sleep environment and make sure they are safe when this happens. All right, 8th question. How can I help my child with bedtime resistance? Well, if your child has some bedtime resistance, it is important that you stick to the routine. An example of a bedtime routine, which we have discussed previously. Also, number 2, limit stimulating activities before bedtime. No sports, no running around before bedtime. Next, create a relaxing environment. Again, make sure the room is dark, quiet, and cool. And be patient. Eventually, your child would have a good sleep routine and a good sleep schedule. Just stick to those strategies that we have talked about. All right, number 9. What are some strategies for handling bedtime fears? Well, it is important that you have an open communication with your child. First, talk about it. Let your child be open to you about it. And let your child talk about their fears. And then, what I want you to do is to offer reassurance and give them comfort. If it will be helpful, if your child would like it, you can offer a stuffed animal, for example, for comfort. All right, number 10. When should I consult a healthcare provider about my child's sleep? You should worry and let your pediatrician know if your child's sleep problem has persisted, even if you establish good sleep habits and you did all the tips that we have talked about. But if the problem still persists, then it's better you talk to your pediatrician about it. Then you should worry and let your pediatrician know if your child's sleep disturbance is affecting your child's daytime functioning. If your child has daytime sleepiness, as we've mentioned, if your child has had some behavioral problems also, then it's important that you talk to your pediatrician about it. And if you suspect a sleep disorder such as sleep apnea, or there's sleep disordered breathing, if your child might have insomnia or restless leg syndrome. Hey, if you like this video, watch my next video where I teach you about other child health problems.